What is the role of oxygen therapy in obesity hypoventilation syndrome? Have you ever wondered how oxygen therapy fits into the picture of obesity hypoventilation syndrome? This condition can be tricky, especially when it comes to managing breathing issues. Obesity hypoventilation syndrome occurs when individuals with obesity experience chronic low oxygen levels and high carbon dioxide levels in their blood. This often happens alongside sleep apnea, which complicates the situation even further. When we talk about obesity hypoventilation syndrome, it is important to note that it is not just about low oxygen. The body struggles to clear carbon dioxide effectively. While oxygen therapy can raise blood oxygen levels, it does not fix the underlying problem of poor ventilation. In fact, giving oxygen alone can sometimes make breathing worse for some patients. In the context of sleep apnea, treatments like positive airway pressure therapy are much more effective than oxygen therapy alone. Positive airway pressure therapy, which includes continuous positive airway pressure and bilevel positive airway pressure, helps keep the airway open during sleep. This improves ventilation and helps the body eliminate excess carbon dioxide. Oxygen therapy is typically reserved for those who still have low oxygen levels despite using positive airway pressure therapy. It may also be used in specific situations where supplemental oxygen is necessary for other health reasons. The focus here is on treating the airway obstruction and improving ventilation rather than just increasing oxygen levels in the blood. For individuals with both obesity hypoventilation syndrome and sleep apnea, starting with positive airway pressure therapy is the recommended approach. Oxygen therapy should be used carefully and only under the guidance of a healthcare provider. This is because it can sometimes worsen breathing issues in obesity hypoventilation syndrome. Regular follow-ups are essential to ensure the right balance of treatments and to prevent complications. To clarify some terms, hypoventilation means breathing too slowly or too shallowly, leading to low oxygen and high carbon dioxide levels in the blood. Hypercapnia refers to high levels of carbon dioxide in the blood. Positive airway pressure therapy uses a machine to push air into the lungs and keep the airway open during sleep. In summary, oxygen therapy has a limited role in obesity hypoventilation syndrome, especially when sleep apnea is involved. It is not the primary treatment but may be used alongside positive airway pressure therapy in certain cases. The main goal is to improve ventilation and reduce carbon dioxide levels, not just to boost oxygen levels. This approach helps ensure better health outcomes for individuals facing both obesity hypoventilation syndrome and sleep apnea.